The following segment is brought to you by Intermountain Healthcare and the Utah Department of Health.
Well, the number of vaping-related lung disease cases in Utah is up to 83, and one person has died. Intermountain Healthcare pulmonologist Dr. Dixie Harris has been on the front line of this vaping illness outbreak in Utah. You looked into it when you noticed a connection between an isolated case in Wisconsin, and then you said, wait a minute, this is a problem in a lot of states.
So what happened was I saw two cases in the same day, two different hospitals when I was on a tele-critical care shift. So we cover several different hospitals. We help monitor and advise to the different ICUs. And I saw two identical cases. The only commonality was the fact that the patients were vaping. And then we had heard about something going on in Wisconsin that was very early on. And then we called the Department of Health.
Okay, and they said, okay, let's look into more cases. So what is it that's causing the problem? Is it the oils? Is it just that there are particulates going into the lungs, or is it specifically the THC?
So currently right now, nobody knows one single cause. 90+% of the cases in Utah, the patients have been vaping THC, but we think it's something that's mixed with the THC, not just vitamin E oil. That's one of the causes we think, but we think it's other, maybe it's different preservatives that are being put in, other things being mixed in it, and it's not all the cases are doing THC. So some of them are only doing E-nicotine.
Okay, so stuff is getting in their lungs that shouldn't be there.
Correct.
And it's causing inflammation and...
Causes inflammation, and the best description is like a chemical burn. There was a very good study that came out about 2 weeks ago in the New England Journal that actually looked at biopsies and the autopsy findings. And their description of it looks just like a severe burn of the lung.
Inside the lungs.
Inside the lung, way down in the air sacs.
Okay, what would you say to anybody who is still vaping and saying it's not going to happen to me?
So I'd say, well, you're taking your chances, and we don't know if it's going to happen to you. We don't know if it's not going to happen to you. I think anybody who's vaping at all should not be vaping. The FDA has very good materials that are out, other ways of getting off cigarettes. If people use vaping as a reason to get off cigarettes, and absolutely avoid the vaping, avoid these chemicals.
Okay, thanks for all you're doing.
Thank you.
Ron, back to you.